Okay, so like trying to keep up with everything happening in India,
Yeah.
like especially in these huge sectors like healthcare.
Yeah.
It's kind of like trying to find your way through a maze, right?
Yeah.
It could be overwhelming.
Absolutely.
So that's why we're doing this deep dive, right? Like taking one big thing that's happening,
Yeah.
breaking it down so we can really understand it.
Exactly.
So today we're going to dive deep into the Union Health Ministry's announcement about their plan
Okay.
to set up cancer daycare centers in all the district hospitals across the country.
All right.
And, for our listeners who are getting ready for those UPSC exams,
Yes.
this is a pretty important development, right?
Yeah.
Because it touches on all those key areas for the mains and the prelims,
Absolutely.
like health policy and governance and the socioeconomic kind of factors.
Yeah, this is a major move. I mean, it's not just like a small tweak. It has the potential to like totally change how people in India access cancer care.
Okay, so let's jump right in. What exactly is the government planning with these cancer daycare centers?
Well, basically, the plan is to set up these dedicated facilities within every district hospital where cancer patients can actually get, vital treatments without having to stay overnight.
Oh, I see.
So imagine like a center where they offer chemotherapy, which is basically, using special drugs to fight cancer.
Right.
And it's not just that, they'll also have counseling services and like access to all the meds you need.
Okay, so it's more than just giving medicine. It's like a whole support system they're thinking about.
Exactly, like a holistic approach.
So what's the capacity like? How many people can these centers actually help?
So initially they're proposing 4 to 6 beds per center.
Hmm.
Now, I know that might not sound like a lot, right?
Yeah.
But think about it. We have so many district hospitals all across India.
Oh, yeah.
So when you add up all those centers across the whole country, the impact on access could be huge.
I see.
And each center is going to have a dedicated team, an oncologist.
So like a cancer doctor.
Right, a cancer doctor or a medical officer who's like specifically trained in cancer care. They'll have 2 nurses, a pharmacist to handle the medications, and a counselor for like psychosocial support.
Psychosocial support?
Yeah, like support for the emotional and social well-being of the patients and their families.
Like, of course.
And then they'll also have a multi-purpose worker who just kind of handles the day-to-day stuff.
That sounds like a pretty big commitment, in terms of personnel and like the whole infrastructure.
It is a substantial investment.
So what's the timeline? When can we actually expect to see these centers up and running?
So they're planning to roll it out in phases.
Okay.
The goal is to have 200 centers set up within this current financial year, so 2025-26.
Mm-hmm.
And they expect the whole project to take about 3 years to be fully implemented, so that it reaches all those district hospitals across India.
Wow. So the main goal here is to make cancer treatment easier to get right, especially for people who live far away from those big cancer treatment centers.
Exactly. The idea is to ensure that people can continue their cancer treatment without having to travel long distances. So, the Parliamentary Standing Committee report actually pointed out that there are currently 764 district hospitals that don't have these dedicated cancer daycare facilities.
Oh, wow.
So the vision is that patients can go to those specialized tertiary care centers, the big, well-equipped hospitals, usually in major cities,
Right.
for their initial diagnosis and, to start their treatment plan.
Okay.
And then for the ongoing treatments like chemotherapy, they can continue that closer to home at these new daycare centers.
That makes a lot of sense.
It just takes away so much of the burden,
Yeah.
the travel costs, the time away from family.
Oh, absolutely.
Think about a family in a rural area when someone gets diagnosed with cancer.
Right.
This could make things so much easier for them.
Yeah, that really highlights the impact this could have on people's lives.
It's about making things more manageable.
So we all know cancer is a huge issue in India.
Yeah, unfortunately.
Can you give us an idea of just how widespread this problem is?
So the numbers are quite alarming, actually. In 2023 alone, India recorded over 14 lakh new cancer cases.
Wow.
And to put that into perspective, that's about 100 out of every 1 lakh people in India being diagnosed with cancer every year.
That's a lot.
And sadly, the projections show these numbers are only going to increase,
Oh, no.
which means we really need these daycare centers. And it also highlights the immense pressure our healthcare system is facing.
Yeah, that's a really sobering statistic.
It is a serious concern.
And I know the government's been keeping a close eye on these trends, right?
Yeah.
To kind of inform their policies.
Exactly. So for like evidence-based policymaking, the National Cancer Registry Program, or NCRP, has been doing really important work.
The NCRP.
Right, they're the ones under the Indian Council of Medical Research, or ICMR.
Oh, okay.
And they've been tracking, cancer incidence and trends all across India since 1982.
Wow, so they've got a lot of data.
They do,
Yeah.
which is crucial for understanding these changing patterns of the disease and for guiding interventions like this one.
Makes sense. So a plan this big obviously needs a lot of funding.
Oh, definitely.
So what does the recent union budget tell us about how committed the government is to this?
So the union budget for 2025-26 shows a huge commitment to the health sector overall.
Okay.
The Ministry of Health and Family Welfare got a total of Rs 99,858.56 crore.
Wow, that's a big number.
It is, and within that, the Department of Health and Family Welfare gets the biggest chunk with Rs 95,957.87 crore.
Okay.
And health research has been allocated Rs 3,900.69 crore.
So are there any specific things in the budget that directly support cancer care and these new daycare centers?
Well, the budget document clearly mentions the plan to set up those 200 daycare centers in this financial year.
Right.
But it also talks about how the government is committed to helping through customs duty exemptions on important cancer drugs.
Oh, that's good.
Yeah, so 36 life-saving drugs, and a lot of them are used in cancer treatment, are completely exempt from basic customs duty.
ABCD.
Yeah, BCD, and then 6 more medicines will have a reduced duty of only 5%.
That's helpful.
It is. It's a big step towards making these treatments more affordable for patients.
Yeah. That's really important.
And on top of that, meds provided under patient assistance programs are also totally exempt from customs duty.
So alongside the general health budget, we see some specific things aimed at making cancer treatment less expensive.
Exactly. It's about tackling the financial burden along with everything else.
That's a big relief for a lot of people.
I think so. It can make a huge difference.
This isn't the first time the government's focused on fighting cancer, though, right?
Oh, absolutely not.
What other initiatives are already out there that this new plan will kind of build on?
So there's already a multi-pronged approach to controlling cancer in India.
Okay.
One of the main ones is the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases, and Stroke.
Wow, that's a mouthful.
Yeah, it's usually just called NPCDCS.
NPCDCS, okay, got it.
It works under the National Health Mission, or NHM,
Right.
and it aims to prevent these non-communicable diseases, including cancer, and to manage them properly at different levels of the healthcare system.
So it's about prevention and management.
Yes, exactly.
And I know there have been efforts to set up more specialized cancer treatment places around the country, too.
Absolutely. So we have the Strengthening of Tertiary Care for Cancer scheme.
What does that one do?
It's specifically designed to bring advanced cancer treatment to places beyond the big cities,
Oh, okay.
to make specialized care more accessible throughout the country.
So kind of spreading it out a bit.
Exactly. And that includes building and upgrading important infrastructure.
Right.
So we're talking about the plan to develop 19 state cancer institutes, or SCIs.
SCI.
Yeah, and 20 tertiary care cancer centers, or TCCCs.
TCTCs.
And then there's the National Cancer Institute, or NCI, in Shahjar, Haryana.
I've heard of that one.
Yeah, it's a major center for research and treatment. And we also have the second campus of the Chittaranjan National Cancer Institute, or CNCI, in Kolkata, which is boosting capacity in the east.
So it's good to see that there are options in different parts of the country.
It's about making sure care is accessible no matter where you are.
And for people who might not be able to afford treatment, what kind of help is available?
Well, we have the Ayushman Bharat Yojana, or PMJI.
Okay.
It started in 2018, and it provides universal health coverage to millions of families.
That's a lot of people.
Yeah, and importantly, it covers lots of different cancer treatments.
Like what?
Like chemotherapy, radiotherapy, which uses radiation to kill cancer cells.
Right.
And surgical oncology, which is basically treating cancer through surgery.
Oh, okay.
And all of that is covered for families that are struggling financially.
That's a lifesaver.
And then we also have the Health Minister's Cancer Patient Fund, or HMCPF.
And does that one do?
It gives direct financial help
Okay.
up to 5 lakh, and in some cases even a max of 15 lakh
Wow.
for cancer treatments, specifically for patients living below the poverty line.
That's amazing.
It's a vital safety net for those who need it most.
So it sounds like they're building a pretty solid support network.
Yeah, they're really trying to cover all the bases.
And I understand there's also some big national collaboration going on with cancer care.
Oh, yeah, for sure.
Can you tell us about that?
So there's the National Cancer Grid, or NCG.
The NCG.
Yeah, it was established in 2012, and it plays a big role in making sure cancer care is standardized and high quality across the country.
Okay, so like setting standards.
Right, exactly. So it's a huge network with 287 member institutions.
That's a lot.
It is, and it includes all the big cancer centers, research institutes, patient advocacy groups, training centers.
Wow, a whole range of things.
Yeah, and together they treat over 750,000 new cancer patients every single year.
That's incredible.
It's estimated that they cover about 60% of India's total cancer cases.
So they're making a big impact.
They are, and this collaborative platform is just so important for sharing those best practices, and developing standardized treatment protocols and moving cancer care research forward.
It's great to see so much happening on the treatment and support side of things.
It's encouraging.
What about research? Have there been any big advancements in cancer research and new therapies in India?
There have been some really exciting developments.
Like what?
So in April 2024, India developed its first ever indigenous RT cell therapy called NextCAR19.
It's a big deal.
It is a huge deal. It was a collaboration between IIT Bombay Tata Memorial Center and ImmunoACT.
Wow.
So to put it simply, CAR T cell therapy is a kind of immunotherapy where they take the patient's own immune cells and modify them in the lab to better attack and kill cancer cells.
I see.
And NextCAR19 is a breakthrough, especially for some types of blood cancers.
Wow.
And it has the potential to make us less reliant on those expensive imported therapies.
So that means more people can access it.
Exactly. It's about making advanced treatment more affordable and accessible.
That's fantastic news.
It's really exciting to see India making such progress in this cutting-edge research.
Are there any international collaborations happening too? Focused on tackling cancer?
Yeah, so there's the Quad Cancer Moonshot Initiative.
Quad, what's that?
It was launched in September 2024, and it's a partnership between India, the US, Australia, and Japan.
Wow, a big team.
Yeah, and their initial focus is on eliminating cervical cancer in the Indo-Pacific region.
That's a big goal.
It is, but it's a really important one.
Yeah.
And they're doing it through things like better screening programs, vaccination efforts, and collaborative research.
That makes sense.
And then on top of that, the Advanced Center for Treatment, Research, and Education in Cancer, or ATREC, right? They're a leading cancer research institute, and they started a big expansion in January 2025.
What's the expansion for?
To enhance the research capabilities, treatment development, and just overall patient care.
So a boost for ATREC.
Exactly, a big boost to help them do even more great work.
So clearly there's a lot happening in cancer care and research in India.
Yeah, there's a lot of positive momentum.
But with a plan as big as setting up these daycare centers in every district hospital, there are bound to be some challenges.
Oh, definitely. No plan is without its challenges.
So what are some of the concerns that have been raised? By experts or in reports?
Well, one of the biggest worries is staffing.
Staffing?
Yeah, so the government initially thought about using the existing medical and paramedical staff at the district hospitals. But a recent parliamentary standing committee report said that there's already a shortage of healthcare workers at that level.
Yeah, that's a problem.
It is a big problem, and they're in lots of states across India.
So they're already stretched thin.
Exactly. And the committee strongly recommended that the government think about recruiting specifically for these new cancer daycare centers.
Oh, so like separate recruitment.
Right, because otherwise it could put even more strain on the existing system.
And that could affect everyone, not just the cancer patients.
Exactly. It's a delicate balance.
That's such an important point for our UPSC listeners too, right?
Totally.
It's a classic example of how tricky it can be to put policies into action on the ground.
Right. Real-world implementation is always complex.
And that's often explored in those governance questions in the exams.
Yeah, it's a key theme in UPSC.
So stretching those already limited resources could really impact the quality of care for everyone.
It could have a ripple effect.
What do the experts in the field think about this whole initiative overall?
Well, most experts are supportive of the main idea.
Which is?
Bringing cancer care closer to where patients live.
Yeah, that makes sense.
But they've also stressed that we need some extra services and support systems to make sure these daycare centers are effective and safe.
Good. What kind of services?
So one really important thing is having good pain management services.
Oh, right, because cancer can be really painful.
It can be very painful, and the treatments can cause pain too.
Yeah.
So making sure there's affordable and effective pain relief at these centers is essential.
Absolutely. It's about quality of life.
Exactly. And since not all district hospitals have oncologists on staff right now,
Right.
there needs to be really thorough training for the medical officers and nurses who are already there.
So they can handle those complex cases.
Yes. So this training would teach them how to administer chemotherapy properly, how to manage side effects and complications,
Right.
and how to provide the necessary supportive care.
It's not just about having the buildings, it's about having skilled people to run them.
Precisely, the quality of care is paramount.
So specialized training and having solid protocols in place are crucial.
Absolutely crucial for safety and making sure the treatment actually works.
Are there any regional factors or differences between states that might affect how this plan is put into action?
Yeah, for sure. The feasibility and the speed of implementing this will likely be different across states.
Why is that?
Because of the existing healthcare infrastructure and the resources they have.
Okay.
So, for example, states in the Northeast and Kerala, they already tend to have a better network of healthcare facilities, including some cancer care services at the district level.
They're ahead of the game.
In a way, yes. So setting up these dedicated daycare centers might be smoother and faster in those regions
Makes sense.
compared to states that don't have as much healthcare infrastructure at the local level.
That was a really thorough look at a really important development in healthcare.
It's a complex issue with a lot of moving parts.
So to sum it all up, we've talked about the government's plan to create these cancer daycare centers in all district hospitals across India.
Yes, a major undertaking.
We've seen how much money they're putting into it.
A significant investment.
How this initiative builds on the existing cancer control programs and infrastructure that's already in place.
A layered approach.
And how it aims to address the growing problem of cancer in the country.
A much-needed intervention.
We've also heard what the experts think.
Valuable insights.
They're mostly supportive, but they've also highlighted some important things that need to happen.
Crucial consideration.
Like having enough staff through dedicated recruitment and making sure healthcare professionals have the training they need.
Key factors for success.
To make sure these centers are a success.
Absolutely.
This initiative has the potential to really improve access to vital cancer treatment for so many people in India.
It's about reaching those who need it most.
And it tackles the issue of making healthcare more equitable.
Ensuring everyone has a fair chance.
Trying to make sure that people can get good quality cancer care.
Timely and effective care.
No matter where they live or how much money they have without having to travel too far or face financial hardship.
Breaking down barriers.
So with all that said, and thinking about how big of a problem cancer is in India and how complex our healthcare system is.
Yeah, it's a multifaceted challenge.
What do you see as the biggest challenges and opportunities when it comes to making sure these cancer daycare centers are successful and have a real positive impact in the long run?
It's a question worth pondering.
It really is.
Because it makes you think about the practical side of things, how it'll all work on the ground.
Absolutely. And for those of you tuning in who are studying hard for your UPSC exams,
best of luck to all the aspirants.
Understanding this issue from all angles is really important.
It touches upon so many relevant themes.
The policy, the budget, the healthcare infrastructure, the potential impact on society, the challenges.
And it's a holistic view.
All of that is crucial for both your mains and prelims.
Absolutely essential for a comprehensive understanding.
So we really encourage you to dig deeper into this topic.
It's a worthwhile endeavor.
This initiative is a big step.
A potential turning point.
And it could have far-reaching consequences for public health and how cancer care is delivered in India.
It's a development worth following closely.
So if you found this discussion helpful and insightful, please like this deep dive, subscribe to our channel for more analysis.
We appreciate your engagement.
And leave a comment below if you have any questions or thoughts about this important topic.
We welcome your feedback.
This deep dive was based on information from the Indian Express and the Press Information Bureau, or PIB.
Valuable sources for staying informed.
Thanks for joining us.
It was a pleasure as always.
See you next time.
Until then.